Hi, my name is Catherine Harris, and my population I chose to do research on is post-traumatic stress disorder. Um, this assignment is covering health concerns we can see with patients with this disorder. So, post-traumatic stress disorder can occur after someone has been in or witnessed some kind of trauma. Usually it has to be something that is shocking or dangerous that they have happened to them or that they see happen to someone else. This would cause them to think that their life is in danger or someone else's life is in danger, or witnessing a loss of a life also. A lot of different health concerns can come from this and health disparities, especially for the population of veterans or someone in the line of work, like a firefighter or paramedic who sees this on a daily basis. Some people go through these traumas and they have a hard time recovering. So some of those health disparities could include decreased quality of life, obesity, cardiovascular disease, just all related to unhealthy lifestyle factors. A lot of them go into depression that they aren't able to take care of themselves physically and emotionally. Traumatic events have been proven to have a physical effect on people, and we see this a lot with depression as well, where mental illness does directly impact your physical health. Same with stress, just a lot of different mental illnesses can have that effect. So people with PTSD are vulnerable for increased health disparity because they could possibly have a hard time holding a job. I know that people that I know with PTSD have a hard time with social connection, being able to be in large crowds, working with other people closely, having those close relationships, that can become harder for those type of people. That could cause them to maybe live in a lower income area because they don't hold a good income. Socialize less, not worry about exercise or eating healthy can be a big thing as well. And also they may turn to substance abuse to get away from their thoughts and their traumas. So that could also lead them to be more prone to violence. In the United States, about 7 to 8 out of every 100 people will have PTSD throughout their life. About 8 million adults suffer from it every year. So generally men are exposed to trauma more often in the moment, but women are more likely to experience PTSD. And then about 5% of children ages 13 to 18 will experience PTSD in their lifetime as well. So quite a bit, quite prevalent. So the social determinants that I found that is affected by this population would be social and community context, and then also economic stability. So I talked about how relationships with family, friends, coworkers, community members are all impacted by this disease, this disorder. People with PTSD may experience anxiety, hostility, agitation, emotional detachment, and self-isolation, which can all lead to them not wanting to be social or participate in the community. This will likely affect personal relationships and relationships with strangers, which is a big part of your health. Another social determinant was the economic stability. If a person has a hard time keeping a stable job, that can definitely have a ripple effect on their housing, what foods they're eating, and what healthcare treatment they're receiving, especially mental illness healthcare treatment. Specific concerns for this population that I found were that they experience aggressive behavior, they have a hard time sleeping or concentrating, they're easily startled, they may experience self-destructive behavior, they're extremely hard to maintain relationships, they feel disconnected with family and friends, and they tend to lose interest in activities they used to enjoy. They will also usually avoid talking about their trauma or anything that reminds them of it. This can cause that disconnect, and they might just avoid all connection in general so they don't have to bring up their trauma. Something that I found for the health disparity of this population, the root cause that I found was social isolation, the loss of interest in regular activities. Having that be the root cause for basically their isolation and their loss of interest will lead them to having a hard time maintaining relationships, loss of employment or trouble finding a job, eviction, or moving to a low income neighborhood and living in poverty. So the root cause of poverty would be that social isolation because they're not having a job and they're not maintaining relationships, and they may lose a lot of their income or um, family as well. With Maslow's hierarchy of needs, when I looked at this, I saw that really there's many factors in the whole pyramid that are affected by this disorder. So basically the only things that I could think of that were met were probably breathing, food, water, homeostasis, and excretion. Those things for the majority of the population are being met. But things that can be unmet in the person with PTSD or that they could struggle with would include physiological needs, sleep being a huge one because of nightmares and night terrors and those kind of things. Safety being employment, health, poverty, that can all be affected. Love and belonging is a huge one for this population. Friendships, family, and sexual intimacy can all be affected. Esteem, self-esteem, confidence, and achievement. These people may feel like the trauma has taken over their thoughts and they can't get past it, and that really does affect their achievement and confidence. Self-actualization, creativity, problem-solving, spontaneity, and acceptance. A lot of times people have a hard time accepting where they're at and what they're doing in life, and they kind of just are at a standstill because the trauma is overcoming their thoughts. I found that in the cases where symptoms continue over many years, a person would not be living a functional life. In every single tier of a person's needs in life, there's a dysfunction a person with PTSD suffers from. So if these continue throughout their life, it can be very, very detrimental. People with PTSD are more likely to have poor health outcomes because they're more likely to not take care of their health, relationships, living conditions, and that can lead to poverty, disease, and loneliness. So specific concerns, including communicable diseases and infections, this population could be at a higher risk for communicable diseases because they live in low-income population, or if they've become homeless. They could have a higher risk of contracting diseases like HIV and AIDS, tuberculosis, influenza, and even COVID-19 now. That would mostly just correlate with people that live in poverty with this population. Non-communicable diseases is a big one for this population because they're more likely to self-isolate, make poor food choices, and have low engagement in physical activity. Their lifestyle choices and the possibility of living in poverty put them at high risk for weight gain that can lead to obesity, diabetes, heart disease, and hypertension. Also, with the stress and depression they suffer from, that can also lead to heart disease and hypertension as well. Engaging this community in a group that can prevent that self-isolation and motivation, and all that can encourage better self-care. Something that is a concern with these patients is taking care of themselves, and suicide is a huge risk factor. That is something to watch for with someone that is struggling with this disorder. They may be stuck experiencing it over and over in their mind, their trauma, and that is hard to get past sometimes, and they may turn to drugs, alcohol, or even have suicidal ideation to get away from those memories. They also have generally a lack of sleep, and so that also messes with their mind. Risk of harm to others can be included with this population because they are more quick to react, their level of tension and arousal is higher. They have a lot more emotional and physical feelings of anger. Because they're experiencing their trauma over and over, they might feel more keyed up and quick to react. So it is important to be aware of that, and so that you can educate people, their families, and their population that is a risk. And here are my references.